Thank you so much for joining us. We know that COVID and this pandemic is really everything that we're thinking about and talking about right now, with not only taking care of ourselves, but also our children and our families. And now with the upcoming school year, I know a lot of parents have questions and just looking for any advice and any guidance that we're willing to share. So thank you so much for joining us tonight. When you're ready, go ahead and get started. Thank you again, Dr. Josephson. We really appreciate you.
Yeah, thank you, Peggy. I'm trying to get my slides up there, so everybody please be patient. I want to share that, this is a really big time of uncertainty, and people are clearly very concerned about what's going on, and for good reason. I mean, this has kind of snuck up on us, and it has caused a lot of anxiety. And I wanted to talk first about saying that, and I found this nice quote from an author unknown, and we need to make sure that we work as a community together to work through this, and we can't let fear or anxiety get in the way of us moving forward so that we can beat this pandemic and be successful, not only for ourselves and our family and our community, but also, of course, our children. So anxiety can stop you in your tracks and hold you back. It's not easy to face your fears and push through them, but it's essential. So this is a time where we need to essentially move forward together to make sure that we get life back to normal. And these are really very unprecedented times, but again, we're going to talk a lot about this. Can I get the next slide, please? So the first thing I wanted to talk about is what is coronavirus? Because, everybody's hearing coronavirus, COVID, and things like that. And what's interesting is coronavirus is a large family of viruses. And interestingly enough, there are 4 types of coronavirus that affect human beings. It's a typical cold that you get during the winter season. Children get it and adults get it. And it usually causes a mild to moderate upper respiratory tract infection. Coronavirus can also affect other animals and usually does not affect humans. But there's something called spillover. There's a number of other animals, including pigs, camels, bats, cats, and they all get coronavirus, and sometimes it affects them, sometimes it does not affect those animals. But if one of those coronaviruses that do not typically affect humans get into humans, we call that spillover. And there's 3 times so far in our lifetime, in the last 2 to 3 decades, where spillover has occurred, where a species of coronavirus that usually does not affect humans got into humans. So back in 2002, people may remember something called SARS coronavirus. And first of all, what SARS means is it's severe acute respiratory syndrome, okay, because that's what this virus causes. And SARS came in 2002. It was an epidemic. It wasn't a pandemic. And it caused people to get very sick. And interestingly enough, about that virus that came out at that time in 2002, it kind of went away. It dissipated in around 2004, and we have not seen it back since, which is wonderful. But then in about 2012, there was another spillover where there was a coronavirus that affected humans, and that was called MERS, M-E-R-S, or Middle Eastern Respiratory Syndrome, also caused significant respiratory problems, and that was in around 2012. Unfortunately, we do still see that virus occasionally. It comes intermittently. It doesn't come all the time. So we do see MERS periodically, but again, fortunately not common. But now we have this new virus called SARS-CoV-2 or COVID-19, and that was declared in March 11th of 2020 as a pandemic by the World Health Organization. Next slide, please. So tell me a little bit about COVID is probably what your next question is I need to know a little bit more about what you're telling me. So what are our objectives here is, number one is, as I shared, we need to educate our community. We need to educate people because education builds power and strength so that we can get beyond this and so that we get away from some things that we are maybe told that's not necessarily true. So we need to know the facts as best as we know them. And we know that sometimes information changes, and I'm going to share some stuff with you all shortly in regards to that. So we need to educate everybody on the latest information. We need to have an understanding about this virus. And a lot of people say to me or say to other physicians or Other people, they say, well, what about the flu? I mean, you know, they kind of say this is similar to the flu. We know that the flu has been a big transmitter from children. We do have flu vaccines out there. We've been doing flu vaccines for years, where we do not have a vaccine for for this novel coronavirus. And so there are many similarities because it's a virus, but there are many, many differences. And obviously, there's a lot we don't know about this virus and that we're trying to learn about to see what the similarities or differences are. But one of the interesting things is that we haven't seen the transmission from children or children being affected like the flu does. We do know that flu is carried by children and is a major impact on children, as well as the transmission of the flu from children to other people. We're not seeing that currently in coronavirus, and I'm going to go into a little bit about the data and what we're seeing to answer some of those questions. I'm going to put on this slide, it says CO space BI space D219. So this is called COVID-19 or COVID 2019. So why did they come up with that? Well, the CO stands for corona, the VI stands for virus, the D stands for disease, and then it's in 2019 is when this disease was found. And then the next question is that mitigate versus eliminate. We would love to eliminate this virus. I mean, that would be absolutely tremendous. But what we recognize now, it's spreading. We do not have vaccinations. We do not have medications that can treat the virus. So what we needed to do, and what the big push was when this virus first came out, was they called it, and people have heard the term, flattening the curve. And the reason why is that when there is a pandemic, which means a large number of people get affected all at once, we wanted to make sure that as people got infected with the virus, that they didn't get sick enough that they all required hospitalization and medical resources at the same time, because we clearly would not be able to take care of that many people at the same time. And so that's why they put into effect some of the things like social distancing and masking, which we're going to talk all about, to keep people away from each other, to keep this at bay, so that we knew that as people got infected, we would have the resources to take care of them, to get them better and then move on, rather than having everybody come at the same time like they experienced in New York. They had a very, very bad surge of patients. Can I get the next slide, please? So what happened? It's a scratch of the head. You know, back in November of last year, 2019, everything was going well in the communities and in the country and in the world. All of a sudden, January 2020, we hear of a possible novel virus that was started in Wuhan, China, and it was started to spread, and that this may be a pandemic, an epidemic for sure at that point. And then in mid-March, it was recognized that it was a pandemic. As I've indicated, the World Health Organization on March 11th declared it a pandemic because of the spread. The federal and state orders were put in place to tell everybody, stay at home until we figure this out. This is true, a public health emergency. The healthcare sector canceled all elective office visits and surgeries. They started to prepare for any surges of patients that would all get sick at the same time and they need to care for. They started to institute practice changes so this way we can manage a surge if they occurred. And then testing practices started to be put into place on how do we test who has it, and they started to do social distancing and other safety items, which we'll talk about. And then other sectors got affected. And as I talked about the flu, we know with the flu that children do transmit that disease fairly commonly and can get infected by the flu fairly commonly. We didn't know anything about COVID at that time, so schools closed. They said that it was not safe. They assumed that this was very typical or similar to the flu. And then businesses closed except for essential needs. Next slide, please. So what is a pandemic? So again, part of our education today, what we have to learn is understand terminology. So when you hear it, you understand what's going on. So first thing is something called an outbreak. An outbreak is when you have an increase in the occurrence of a disease. And that could be just in a small area. A bunch of people get a disease, and we call that an outbreak. You can have a pandemic, and then you can have outbreaks in areas, just like what we're having is when you have a red zone, they call it now. It's an outbreak of the virus in an area. So it's an increased number of cases that are occurring. An epidemic is an outbreak of a disease that spreads quickly and affects a lot of individuals all at the same time, but it may be contained in a certain geographic area. But a pandemic is when that epidemic, it is an epidemic, it has much greater proportion, it affects a lot more people, and then it starts to spread over countries and continents, and that's why this is considered a pandemic. And the number of lives lost in a pandemic, and that's why we have all these safety mechanisms that we put in place, is how many people are infected. If not that many people are infected, we can contain it and maybe get a cure or vaccination and prevent more people. How severe is the illness? So we need to learn a lot more about what is this virus going to do? How sick is it going to make people? Does it give you just a common cold? Will you shake it off in 3 to 5 days, or does it cause more severe disease? And we're learning, particularly in the elderly population, this is causing a more severe disease. How vulnerable certain groups are to this. And again, we are learning that either the elderly population is more vulnerable to this infection, as well as people that have what we call comorbidities. So they're diabetic or hypertensive or have other cardiac diseases. They will be more affected by this virus if they get it. And then what are our prevention efforts? How do we prevent the pandemic from continuing to spread, and how effective are those prevention methods? Next slide, please. So what are the statistics telling us? That's what everybody's saying. So tell me about this. I see on the news that it's this many new cases are out there. So as we test more patients, more people, whether they're symptomatic or asymptomatic, and we're going to talk about that shortly as well, we're going to have more positive cases. So the positive case rate is going to go up, but that doesn't mean these people that are testing positive are sick or ill. So when we think about the population, the United States of America is the 3rd largest population in the world. There's 330 million people in the United States. We have about 7.8 billion people in the world. China and India are the leading 2, and then the United States is number 3 in world population, again, with 330 million people. And the childhood population of the United States is about 75 to 76 million people. So when we look at all cases, and as I mentioned, this disease is changing and it's affecting people on a daily basis. So the numbers that I'm going to show you here, I've tried to put dates on when I got those last numbers, because every day that's changing as more people are being tested, more people will be positive, and so on and so forth. So far as of August 2nd, which just a few days ago, there was 4,620,000 plus cases in all ages. That's not just children, that's all ages. But there was 338,000 children cases in the ages of 0 to 18. So less than 5% of children are affected by this disease of what we know currently, okay, or less than 10%. So childhood hospitalization, so, I get a lot of the data from the Children's Medical Association and the American Academy of Pediatrics, and there's other sources of data. So when I pulled a lot of this data together, sometimes it's when states are reporting. Some states will report hospitalization, some will report just how many positive cases there are. So when we looked at the number of total hospitalizations of all patients' ages, there was 20 states plus New York City reporting, and they had about 195,000 total hospitalizations. Again, that's only 20 states reporting. And of those 20 states reporting, 2,669 child hospitalizations. So again, looking at the difference of the number of children that are requiring hospitalizations versus the total population continues to make us scratch our head to say, are children getting affected by this? Why are they not getting affected by this as much? Are they spreaders? And we're going to talk more about that. The other thing that's very interesting is mortality, obviously. And obviously, one lost life is one too many. I have this data from, again, back to August 2nd, so just a few days ago. I think we're over 160,000 total deaths in the United States currently. When I made this slide, it was 154,000, which was, again, on August 2nd. And this is with 44 states reporting, and there's only 86 childhood deaths so far. So when I say only, again, one is too many, one person is too many. But when you look at the proportion of children that have not done well with this disease and have actually died, it does, again, make you question, why is it that there's such a disproportion of children? And fortunately, it is. Again, we would like no one to die from this disease, but it's kind of nice to see that our children are protected for one reason or another. Next slide, please. So more statistics and closer to home. So I shared statistics about what's going on in the United States. Now I'm going to share statistics about Florida, and then I'm going to get us up to our community here in Northeast Florida. So the Florida population is 3 million, or child population is 3,500,000 children. Now it's interesting, the way Florida reports this, and this is interesting as we go through this data, Florida reports 14 and younger in the children category. So they report as 0 to 4 years of age, 5 to 14 years of age, and then 15 to 24 years of age. So when you look at the total number of cases that are affected in Florida, this is total Florida, South Florida and North Florida, there was 8,000 positive cases in the ages of 0 to 4. There's 19,000 5 to 14 years of age, and then I included 15 to 24 years of age because, again, we think of children as 15 to 18, give or take, and there's 75,000 children that were affected between the ages of 15 and 24. And so if I just take the 0 to 14, that's 25,000, and when you look at, there was 502,000 cases in Florida that tested positive. Again, you look at that small percentage of children that are afflicted by this disease for reasons that are not completely clear as of yet. Again, total number of hospitalizations, 28,000 for all ages in the state of Florida. 0 to 4 years of age, only 170 children have been hospitalized. 5 to 14 years of age, only 130 children have been hospitalized. And then when you get to the later adolescent years and then the early adult years, 15 to 24, it's 705 hospitalizations. And then when we look at total deaths, 0 to 4 years of age, and again, there's over 7,000 deaths in the state of Florida, total of all ages. 0 to 4 years, 0 deaths have been reported. Between 5 and 14 years, only 3 deaths have been reported. And then between 15 and 24 years, there's been 20 deaths have been reported. Again, this is for the entire state of Florida. Next slide, please. So this is, again, closer to home, Northeast Florida. This is just the number of cases in those different counties, the 6-county area that's included here. And those are tested positive cases for Northeast Florida. And then so far, total deaths, 252 for Northeast Florida. Next slide, please. So Wolfson Children's Hospital, Nemours Children's Specialty Care, we only take care of children. Wolfson Children's Hospital is the only children's hospital in Northeast Florida until you get down to Orlando or you go out west or north from here. It's actually, we even take care of the South Georgia area. And when we look at the statistics within our hospital here in Wolfson Children's, I think it captures really the sense of what's going on here in our community, because although some of the outlying hospitals in our community do admit some children, is very few, and certainly not the more ill children. So the data that I've collected here is regarding Wolfson Children's Hospital and Nemours Children's Specialty Care. And we do a lot of things here to protect our families from making sure that they don't get this disease or any other. And I'm going to share all of the different things that we've put into place, because we know that medical care is essential for our community and essential for the children that we take care of. And so we put a lot of things in place because we know people are a little concerned about coming to the hospital and think it may not be safe, but actually it is quite safe. And we want it to be safe because medical care is necessary, and delayed medical care could make a problem worse. And we want to continue to provide the care early on so we have our best outcomes. But when we look at our statistics for Wolfson Children's Hospital, we have been testing a lot of children here. Total COVID testing has been 4,558, so that's the number of tests that we've done in children. 3,910 have been negative, 197 positive tests. We have 451 that are still pending out there, because it takes sometimes anywhere from 4 to 7 days for us to get some of those results. We've had 42 Wolfson hospitalizations so far. I will tell you that we have a complete, what we call a COVID unit. So if we have a patient that tests positive that needs to be admitted to the hospital, they go to a special place in the hospital where that it is set up for patients that have COVID, so that we reduce any kind of infection for any other patients that are in the hospital or need our care, as well as protects all of our staff and our physicians and nurses. And so we have everything set up appropriately to do that. We have had 0 deaths at Wolfson Children's Hospital to this date, which is wonderful. The other thing that we've set up is pre-surgical testing. Now that we do elective surgery again, every child that gets surgery at the Children's Hospital gets testing, even elective cases. So if a child comes in for an elective surgery, they get what we call pre-surgical testing. We've tested 2,348 patients. Of those, 2,015 of them were negative. 17 of them were positive. And remember, some patients, whether it's adults or children, they're asymptomatic, meaning they have no sign of infection and they may test positive. So we need to keep that in mind. And then community reporting, because we take care of a lot of patients that come from other hospitals or transferred in. We do have 69 patients that were reported positive but unverified that we did take care of, or we did repeat their testing and put them in the COVID unit. So we take patients that we're not sure if their COVID status is unknown, they go to the COVID unit until we get a confirmation of what their COVID status is. Next slide, please. So safe practices, like I said, we're implementing a lot of things in the Children's Hospital and also at the specialty care clinic here. We care about our families and we want to make sure that they're safe, and we want to make sure that they know that they can come to a great place to get the care that their children need timely without having to have concerns that they may contract this disease. So what do? Everybody gets temperature check when they come in, and if they have a fever, they have to go through some other processes before they're allowed to be in the building. There's question screening. So patients and families are asked, have you had a cough? Have you had fever over the last few days? And have you had shortness of breath? Any type of symptoms that may indicate a sign that they may be infected. So they have these screening questions before they're allowed to enter the building. Then masking is required for our patients, except for children under 2. Social distancing is put in place. In our waiting areas, we have patients sitting 6 feet apart, and so we put all this social distancing criteria in place and make sure, and we actually have people that are walking around making sure that people are observing those things so that we keep our environment very safe. We also, at this point, and this is one thing that we hate to do, but we have 1 child and 1 parent. We don't want to limit the number of people that are coming through the building that are not absolutely necessary. Although we feel, as being family friendly and child centric, we understand that sometimes people want to have both parents at the hospital or at the clinic together. We really, again, are doing the best we can to limit the number of people coming through the building, to limit exposure to this disease until we have a better handle on things and keep our environment as safe as possible. So although sometimes that is frustrating for patients and families, we're doing it for safety, and safety number 1. Again, elective pre-surgical testing, as I shared, we do that so this way we're not only protecting our patients and our families, we're also protecting our staff, our physicians, our nurses, all our associates are being protected to make sure that we have the appropriate appropriate information that we need to take care of children safely and protect everybody to make sure that they don't contract the disease. Because also, if our employees get sick, then we have less people to help to continue to contain this pandemic. We also do frequent sanitizing and cleaning. We've always done that. We're even doing that more. And we do have protocols set up for in between every patient, although we did that before as well. But we even have added levels of protection in that regard. And then obviously the safe protocols, like I said, about the COVID unit that they have, and that even if you're not COVID positive, but you're COVID suspected, you go to the COVID unit until we get confirmation of which way you are from testing. Next slide, please. So the key questions that everybody's going to ask or wants to know, and that's why we're here to talk about this and educate, is number 1 is, are the low rates of confirmed infection in children because children are just not becoming infected, and are they not infectious? And so those are 2 very important questions that people are even asking. Should I send my kid back to school? Should I go to the grocery store? Is my kid going to be okay when they go to the doctor? What's the risk for my child and for myself in getting exposed to this disease? Is COVID-19 usually so benign in children that it doesn't require hospitalization? I don't know. The data that's coming out there, and I'm going to go through some studies that have been very interesting. And then we even talk about, it's interesting because we're seeing lower numbers of kids getting infected or maybe transmitting the disease, but we're even seeing that potentially in some of the kids that have some immunosuppression or other comorbidities, and they're not getting quite as affected as the adult population or the more senior population. And then if children are infected, are they infectious, which is what everybody's also worried about, is are they going to give it to other people? And we do something called contact tracing, which I'm going to talk about in a minute, so that we can determine or understand more about the infectious nature of this disease. So next slide, please. So early on, the first study that came out, or one of the earliest studies where they did contact tracing. So contact tracing, what they do is they look at one person who has the disease, that's called the index person, and then they look at all their contacts, and they test their contacts and see if they have disease, and then they can see, are these people infectious? So one of the first studies that came out from China and actually did appear to confirm that children did have a role in transmission. But since that early study that came out, and again, that was one of the earlier studies that came out, there's been a lot of studies in this regard where they've been doing more contact tracing. And so there was widespread community testing in Iceland. And what Iceland did is actually they took their high-risk pediatric group compared to the general population, and even in their high-risk group, they found that they had 6.7% positives compared to 13.7% of the adult overall general population, which was very interesting. So then what they did is they did invited screenings. And so they said, you know what, anybody can come and you can get screened, symptomatic, asymptomatic. And what was interesting about this is that in that invited screening, they found 0% of children under the age of 10 had infection or were positive versus 0.8% for the general population overall. So that was pretty interesting. Another very interesting article that came out, and again, there's numerous. I mean, the stack of articles that I've read, I'm trying to give some of the ones that I think were more salient in making some of these determinations. What was interesting is the first place that had the first death in Italy was Bo Italy. And when that death occurred, they closed everything down and they tested 86% of the population with screens. And interestingly enough, in this, they found that 0% of children under the age of 10 tested positive versus 2.6% of the general population. So again, another sign that's interesting to say, you know, why is children not getting infected? And even some of those children that tested negative were in households of COVID positive parents or family members. So that was very, very interesting. Next slide, please. So then other studies came out. So Japan did a study, and actually, you know, Japan is a very highly populated country with a very small geographic area, and they found that there were lower attack rates in children. So children weren't getting infected as much as the adult population. They did another study in China where they found the same type of thing through contact tracing, and they had very low rates of children being infected from the disease. So what is the evidence started to emerge from this is saying that children were less likely to be infected than adults. And then the question again comes, well, why? Why is this happening? And some of this stuff is still very speculation. So they think that maybe children just have a more transient disease or asymptomatic and don't get really sick, because if you remember from the first or second slide that I talked about, coronavirus is out there that does cause illness in people, the common cold. There are 4 variants of that. And so the question is because children tend to get more viruses than adults overall, maybe there's some cross-protection from the infections from those non-SARS coronaviruses that are helping children be protected, and the adults are not getting that same protection. There's also a receptor that the virus has to attach to cause infection. And one of the things is that there may be a decreased expression of this receptor in children, or maybe they have less receptors because they're so much smaller or younger than adults, and so therefore the virus has less receptors to bind to cause a problem with the infection. The other thing that they found too, which is more recent, is they said maybe the children do not have, because they have a developing immune system, maybe they don't have the type of inflammatory response to fight the infection like adults do. So again, these are all speculations, not anything that's been absolutely confirmed, but these are areas that researchers are looking into to see if that's why we're seeing less infection or less affected in children. Next slide, please. So then the next question are children spreaders? And that's what we, again, okay, you're not getting infected, but are you spreaders? Because as we talked about, you can have asymptomatic children, and then are they spreading it to the adult population or other children? And so there was a large study where they did international family clusters, and they looked at the index case in the household. So they looked at who was the person in the household that was infected, and then they tested everybody else, and they found that the child was the index case, or the case with symptoms, in approximately 10% or less than 10% of the time. This was an interesting study that came out from France. They did a family cluster in the French Alps, and they had a child who tested positive, so that was the index case, and that child actually had 100 contacts, or over 100 contacts, in schools and in ski schools or ski resorts. And they tested all of those people, and none of those people that had any contact with that child were COVID positive. So they said that was interesting that for whatever reason, here's a COVID positive child who's symptomatic and did not transmit any disease to anybody else. Next slide. So this is the big study that came out a few weeks ago and actually had everybody a little bit crazy. And it's a very good study for a lot of good reasons, but it also has a lot of gaps in the study. So this was a study that came out from South Korea. Again, they did contact tracing. They had 5,706 index patients. Okay, so those are patients that have disease, and then they follow the contacts. So they had 59,000 contacts. They broke it into two groups. Those groups were household contacts and non-household contacts. And what was interesting, and then they broke it into groups. So they broke those index cases into groups of 0 to 9 years of age, 10 to 19 years of age, 20 to 29, et cetera, and going further. So the thing that was actually very concerning to a lot of people, particularly as we started getting to the school time, is the index patient in the age range between 10 to 19 years of age had 18.6% contact transmission, which was the highest transmission rate in the study. But the other thing that was interesting is index patients in the age of 0 to 9 had the lowest transmission rate of the 5.3%. So it was the lowest transmission rate of any of the other groups. But the other thing that was interesting is they found that 11.8% of the household contacts got infected versus only 1.9% of contacts in non-household contacts. And one of the things that was interesting about the article is they were saying, well, maybe we should tell people to be wearing masks in their home. And so that's an interesting observation. However, keep in mind that you can be asymptomatic with this disease, unfortunately. So them proposing someone was the index cases because that person was symptomatic and they tested positive. And then they may have tested some other people in the house, and if there may have been an adult that was asymptomatic, it may have been the person who actually started or was the index case, but that assumption is not there in this study. So again, a great study because of the size of the study, but certainly doesn't give us the answers. And again, there's a lot of mixed messaging from other studies that we see as I've shared. Next slide, please. So signs and symptoms in children, so similar to an adult disease: fever, headache, sore throat, cough, fatigue, nausea, vomiting, diarrhea, and then obviously there's asymptomatic cases. Interestingly enough, that many children will not start off with fever and cough like adults do. Some of them will only have GI symptoms, which is interesting. So we have to have high suspicion in patients that maybe just have GI symptoms like diarrhea, nausea, or vomiting. Next slide, please. So what's modes of transmission? And this gets into why we've put into place some of the things that we did. So there's something called droplet spread. So that's when someone's talking to you and you're close face to face, you're not wearing a mask, and then they cough or they sneeze, and then some of the viral particles get into the air and you breathe it in, and that's called droplet spread. And we know that this is the primary mode of spread for this disease. There's something called aerosol spread, which means that someone coughs and sneezes and it actually becomes airborne or suspended in air, and then someone else comes in that air and breathes in those particles, and then they get infected. And we're not seeing aerosol being a big issue regarding this disease, which is actually a good thing. It's a good thing that it's not aerosol, and droplet is also, although not good, but it's a better route. Surface contact, we do know that the virus does live on surfaces. And that's why washing hands and using hand sanitizer and cleaning surfaces is so important. And there's also been some articles regarding vertical transmission from mother to fetus. Fortunately from this, most of the mothers that have contracted the illness was in the 3rd trimester, and from what we can see, the fetuses or the newborns were not really, if they even were COVID positive, they didn't have significant disease for this acute disease right now. Next slide. So that's why the recommendations, as I shared, it's droplet, and so the recommendations are masking, and the reason why we ask people to wear cloth masks is because if you sneeze or cough, you're less likely to go ahead and contaminate someone else. Social distancing was probably as, if not more important than masking, because we know that if people are 6 feet apart, it's very unlikely if they sneeze or cough or something like that, that it's going to be able to be communicated to communicable to another person. Hand hygiene is absolutely essential, and please remember, washing your hands with soap and water is not replaced by hand sanitizers. Washing your hands with soap and water actually eliminates or removes the infections and things that are on you. Cleaning your hands. Hand sanitizers kill any infections, but is not as good as washing your hands with soap and water. But certainly, it is something that we use and is a very good thing to do. And the other thing that I put on here is keeping people up to date. And one of the things we want to make sure is not only our parents, but our children do not fall back on their immunizations. It is absolutely important that people do immunizations. As everybody knows, we're going into the flu season coming up soon. And more important than ever before, people getting their flu vaccines is going to be important because we really need to mitigate or eliminate flu transmission so that we're not confused as people having flu or COVID. So it's very, very important that people get immunized for their flu or get their flu vaccinations this year. But again, in children, please make sure people get up to date and don't fall behind on the essential vaccinations that children need to keep them healthy. Next slide. So what do we do if we suspected to have COVID exposure? So the first question, because we have a lot of people that say, I think I was exposed, or I walked by someone, I heard they were COVID positive, and now I'm exposed. So what's the definition that the CDC gives for exposure? It's being less than 6 feet without a mask for greater than 15 minutes. There are other types of exposure, like sharing a glass or eating utensil with someone who ends up being COVID positive, or direct physical contact with someone who's COVID positive, or providing care at home with a COVID positive person. But for our definition, if you walk past someone and they're COVID positive and you walk past them, especially if you're wearing a mask or you're greater than 6 feet, you were not exposed according to the CDC guidelines. What the CDC says is that if you are exposed, they recommend 14 days after that contact that you quarantine and watch out for fever and other symptoms. Next slide, please. So if you say, I had, or my child has had COVID, when is it safe for me or them to be around other people? So there's something called the symptom-based approach and something called the testing-based approach. And the CDC actually really pushed the testing-based approach previously, but now we're going to the symptom-based approach for various reasons, and I'll explain why. But the symptom-based approach says if you think or know you have had COVID-19 with symptoms, then you want to do 10 days of quarantine since the symptoms began or that you tested positive, and 24 hours fever-free, not on any kind of medications that reduce fever. So you have to be without any, and also that your symptoms, your cough and other ailments are getting better on the way to recovery. We know that some people won't be completely better from the illness after 10 days and still have some symptoms, but they will not be infectious at that point. If you tested positive because you decided you wanted to get COVID tested, or your child tested positive but they have no symptoms, they still say the 10-day rule, so 10 days since the positive test, and if they remain with no symptoms and no fever, then it's okay to go ahead and get involved with other people again or socialize. The testing-based approach, what they used to say is after the 10 days, you should have 2 negative tests at least 24 hours apart. And they've kind of gotten away from that because there are some people that even though they're not infectious, they still may test positive with the PCR test, and I'm going to explain. The reason for that is that even if the virus is not active anymore, there may be viral particles that are still latent there that are just part of the virus, but no longer no longer active, and therefore, after that 10 days, you may test positive still, but you're not infectious anymore. And that's why they went towards the symptom-based approach versus the testing-based approach. Next slide. So available testing, I was just talking a little bit about the PCR. So what the PCR is actually they're looking for some genetic material from the virus. They either do this with a swab in the back of the throat, a swab in the nose, or the swab in the back of the nose. The swab that goes into the back of the nose is considered the gold standard, and then they do testing and they look for this genetic material. And if they see the genetic material is there, then you're COVID positive. Now, again, as I've indicated, even after the disease has gone, there has been signs or evidence that there may still be some dead viral particles or pieces of viral particles that are remaining, and that's why you may still test positive but not infectious. Then the second thing I want to talk about is serologic testing. So we have antibodies in our body, and when you get infected with COVID or any other type of illness, there's one type of antibody called IgM, and that is like the immediate to go your body makes IgM antibodies and starts to fight this infection. And while it's doing that, your body is also producing a second type of antibody called IgG. And what IgG does is that's what's going to protect people from infection later on, because once the IgM goes up and it fights the infection, the IgG starts to go up around 14 days, give or take a few days. Then when the IgM comes down, the acute infection's gone, the IgG stays in your body so that if you get exposed to the virus again, your body recognizes it and prevents it from causing a bigger problem or ailment for you or illness for you. The question is, there are some things that our body produces a response with IgG, but that IgG does not last for a long, long time. Sometimes it lasts a good portion of our lifetime. And that's another thing that we're trying to learn about this virus and our body's reaction or how it will do. And as vaccinations are being made, you're trying to see if they can make a vaccination that will get our bodies to make IgG that lasts a long time to protect us from future illness. Next slide, please. So what about treatments? Right now, most of the treatments are supportive care because, they're testing a lot of different medications. Anti-inflammatory medications seem to be working like steroids. Because it's got a lot of inflammatory properties of when you get infected with this disease. A lot of people have heard about chloroquine, and there's a lot of debate. There's been articles. As a matter of fact, I read an article about a week or two ago from the New England Journal of Medicine that said that the studies are not showing that chloroquine is working, or chloroquine with another antibiotic called zithromycin. However, there's also a lot of articles out there that say that it does work. People don't know if it works, if it's given earlier or later. So again, this is all information that's currently under debate and under investigation, and we need to continue to see what the evidence shows by the studies that are coming out to make the best determination of what is working. And that's with anything. There's antivirals. People must, I'm sure, have heard on the news and in the newspaper about remdesivir, which is a new antiviral that they're trying, and they're seeing if in large subsets of populations, if it's decreasing the length of the disease or improving the outcomes from the disease. And again, still learning a lot about this. But currently, because we really don't have any definitive treatments that we know, it's supportive care, a respiratory support because we know this is a respiratory virus. And so those are the things that we're doing. Sometimes the care is, it's mild symptoms, asymptomatic mild symptoms, and sometimes obviously more severe disease where patients need to be put in the hospital and then cared for in that regard. Next slide, please. So prevention. So right now we really have to try to prevent because again we want to limit that curve, keep it down, so this way we can take care of patients as they get infected with the disease. We don't want too many patients needing care at the same time. So again, we want to try to push that curve down. So how do we do that? We're doing that physical distancing, 6 feet apart. Actually, some of the data that's recently come out regarding schooling and things like that is they're saying that anywhere from 3 to 6 feet, because some classrooms aren't big enough to get each desk or each person 6 feet apart, but 3 to 6 feet, but 6 feet would be optimum. Personal hygiene, like hand washing, as we talked about, use of protective equipment like masking or gloves and goggles, case contact identification, and we kind of talked about we want to find out who the index case is and then test those contacts that that person had. We want to limit size of gatherings because, again, the larger the gatherings and the closer people are together, the more likely that they're going to transmit disease if they're infected. And then obviously continue to do more and more cleaning and sanitizing and disinfecting. And again, there's soap and water for cleaning and sanitizing. There's also disinfectants, and obviously for more significant disinfection, you want to make sure that you read labels on any bottles on what's required, and we want to be careful because a lot of these disinfectants can cause some harm to humans and particularly to our children. So you want to keep them away from some of those things, or there may be a period of time you need to keep them away from a room that was cleaned with certain disinfectants. And then vaccine development, and that's one of the things. If we don't have therapeutics, and again, the world is working on different types of medicines and testing them and see. But one of the things that we're really working on, and I talked to you all about IgM and IgG, and what a vaccine does, it actually, you give a vaccine and your body produces those antibodies, that IgG antibody, and that antibody recognizes that vaccination, which is made to either look like, there's different types of vaccines, but there's some that are made to look like the virus so that when the virus comes, your antibodies recognize it. There's some made from viruses that are inactive. So maybe a coronavirus, but it's inactive, and they'll make a vaccine from that. So they give that, and then people make antibodies. But one of the things I thought was interesting is there's something called Vaccine Tracker. You can look it up on the website. It came also up in the New York Times. There's over 140 companies and universities that are working together to produce a vaccine currently, and they're in different phases of trials. There's phase 1, 2, and 3, and then if they pass phase 3, which is when they're testing on human beings and it's been successful and safe, then those vaccines come out and can be used. And right now, there's a number of companies that are in phase 3 that feel that there will be a vaccination that will be available in the late fall to early winter time. So next slide, please. So what about returning to school? And I'm sure a lot of people that are on this thing are saying, that's what I wanted to know. I want to know the questions about school. And we're going to try to take as many questions as possible. And I want to thank everybody for spending the time to be on here. But I want to say first that the AAP and the CDC recommends reopening schools, but they don't say that without saying there's a lot of caveats. It depends on the community. It depends on what the child's needs are. The reason why they're saying that schools need to be open is because schools are a very important infrastructure in our community. Schools don't only provide education. Schools provide meal programs for a lot of our children. It also provides social, physical, behavioral, and mental health opportunities that they may need so that they can cope with different things. It provides a safe, supportive learning environment. It also employs our teachers and this other staff that work in the schools. It enables parents, guardians, and caretakers to also do other jobs or go to work so that the kids are safely taken care of. So there's so many aspects of the reasons why it's important that schools are open. But again, we have to work together as communities and with our school districts and the administrators and our healthcare professionals to help to say what is the best way to open up our schools, what is the protocols that are going to be put in place so that the children can be cared for safely, get the education and the other support that they need with the other special learning that we offer at schools and the other support services that we offer at schools, but we need to do that safely. And I know a lot of the school districts are working on all of those things. I get emails, not emails, but information on a very regular basis for what different schools are doing. And your schools are working very hard to try to provide a safe environment for not only the children, but the teachers and the staff. And we need to do that. And again, our community as a whole. Next slide, please. So I ended this presentation with a similar picture because anything that we say is impossible actually is possible, and it's resilience. And I know we're going through some very, very challenging times, not only in our community, but in our country and in our world. This is something that I've never seen in my lifetime, and I'm sure most of you have never seen in yours, and I hope that we never see something like this again. But what we do is we can't go ahead and say, throw up our hands and say there's nothing we can do. When we think that things are impossible, and sometimes it does feel that way, we have to start by doing what's necessary. We then do what's possible, and then suddenly we're doing what we thought was impossible, and that came from Francis of Assisi. And again, when vaccination comes out, therapeutics come out, and we've done this with other illnesses that have plagued our societies, that we've been able to manage and maintain and make this world a better place for everybody and make it safe for everybody. But we need to work together and not let things fear us. Everything is possible when we work together. Next slide. So I want to thank everybody for your time, and you did this on a Friday evening, and so I appreciate that so much. We want to take some questions that people may have, and again, my heart goes out to everybody, and everybody should stay safe and well. And we're here at Nemours and at Wolfson's to go ahead and make sure that we answer your questions and take care of your children, make sure that we take care of them safely. We do not take this in any way but serious, because we know that it's not only safety for the children, but it's also safety for the families. And we want to make sure that everybody stays well, because prevention is going to be much better than if we're taking care of people that have more advanced illnesses. We want to make sure that we take care of you safely from the get-go to prevent other issues. So thank you very much for your time, and I'll turn it back over to you, Peggy.
Thank you, Dr. Josephson, so much. Thank you so much. This has been very informative. A couple of things before I ask the questions. I want to remind everybody that has joined us today that you can submit the questions in the invite that you received. There was an email address to submit questions in advance. We've been getting so many really great questions that unfortunately we're not going to be able to answer all of them. So if you do email us, we promise to reply to your specific questions. Secondly, a lot of people have asked in the chat and the question function, will this be recorded and will it be shared? And the answer is yes. We will be sending everybody a thank you email the beginning of next week, and we can also follow that up with the recording of tonight's presentation. So Dr. Josephson, we only have a few minutes left. I do want to ask you a few questions that have come in tonight. You talked a lot about the vaccine that different companies are trialing right now. How can parents feel comfortable and know that it will be safe, knowing that it has not gone through a long clinical trial?
So there's a lot of things that are looked at before a vaccine is released, and it's not only just time, but it's also the number of patients that have volunteered to take the vaccine, and then they see that the safety level is very safe. And so there is a number of factors that need to go in place, again, beyond just time, to feel that a vaccine is safe for it. And you can see that. And what I would encourage, again, is it's actually kind of interesting, is to go look at that website on Vaccine Tracker, because it does share a lot about the companies and the universities that are working together to produce these vaccines and what the protocols are. And it tells you a little bit more about if it's in phase 1, what is phase 1, what is phase 2, what is phase 3, how many people were tested with this vaccination, what the safety level is for that vaccination. So don't go just by time, go by the safety protocols, number of people that have actually taken the vaccine in the trials, and that helps to make the decision if you think it's safe for your child. I would also recommend that you speak and ask these questions to your primary care doctor. They will be very, very much up to date on any of the vaccinations and can give you the most information on its safety and efficacy. Okay,
thanks. And I would assume the FDA is involved and they're not going to release anything that would be unsafe, correct?
That would be absolutely correct.
Okay, good. We've had a lot of questions, Dr. Josephson, about children who have pre-existing conditions like sickle cell or asthma. These kids have to go back to the traditional school. What advice, do you have any additional advice for those parents knowing that their child is going to be in a mask, is going to be as safe as possible, but if there's any pre-existing conditions, do you have any additional advice for those parents?
So again, the first thing I would do is I think that it's incumbent on the parents to be part of the team in taking care of their child and getting them to school safely. So I would recommend, that you do monitor them with, temperatures and symptoms before they go to school. So you could do that at home. It's a very simple thing that you could take their temperature before they go to school to make sure that they do not have any fever. Doing the protocols as we shared with masking, social distancing, you need to work with your teachers of your child's classes to make sure that those things or those protocols are in place. The good news that I can tell you is that although we are seeing that there's increased risk to people with comorbidities, we're not seeing that at the same level in the pediatric population as I've shared. And again, although there's still a lot more information that we need to gain and learn, that as long as you do the masking, the social distancing, make sure that there's cleaning, make sure your child is doing a lot of hand washing, make sure you're working with the school administrators and the teachers so that they have other children do the same thing, then in that regard, you're going to make the safest environment as possible.
And I do want to ask you one more question. For the children that are going back to school, do you have any advice for lunchtime in the cafeteria, since we know the children will have to remove their mask to eat? Is that a safe environment? And there's been a few questions about even the restaurants that are open and following the protocol of 6 feet apart. Is that safe? So can you talk a little bit about that, please?
Absolutely. So first of all, when it comes to the schools, let's talk about schools first, is that some schools may have the child eat in the classroom and stay on their desk. So, work with your schools to see what they're doing. In Florida, we're fortunate that the weather is warmer for a longer period of time, so there may be opportunity where the children go outside to eat and then are spaced 6 feet apart. And we know that people will do better outside, better than in an enclosed environment or inside. So ask your school what they're planning to do. If it is in a cafeteria, hopefully they limit the number of students that are in the cafeteria at any given time. So there may be more frequent lunch times, and then there'll be cleaning in between the different lunch breaks that the children have. And a lunch break probably won't be an hour. It may be 15 minutes, to give the chance for the child to take off the mask, social distance in a clean environment, have their nutrition, and then get them back to their classroom or outside to whatever activity that they need to be involved in. So again, this is something that it is safe if you make sure that these protocols are adhered to. That's the best way to keep things as safe as possible. The second question you asked is about restaurants. Well, I would tell you that the same thing in a restaurant. Don't go into a restaurant if you see every table is full and people are sitting on top of each other. Even if you're with your family, you want to try to manage social distancing as best as possible. Maybe not necessarily 6 feet apart, but maybe don't take a booth. Maybe take a table with chairs where the chairs can be a little bit more separated apart. And clearly, if you have someone who's ill in the family, has a cold, a cough, probably best not to go to any outdoor venues, whether it's a restaurant, the grocery store. It's probably best to take, stay at home and then bring the food in from the grocery store to home, having the healthy person go and pick it up.
Excellent. And the final question I'm going to ask you tonight is about masks. Some schools are not requiring everybody wear masks. Some kids are 3 years old going to school that will not wear a mask. Does that present any challenges, and should we rethink those situations?
So according to the AAP and the CDC guidelines, number one is they say children that are under 2 should not wear a mask. So that's out there, and so now you talk about your preschool age children, and they are saying that a preschool age children is very difficult to keep a mask on. Obviously, it would be preferable if you could, but those children do not need masks. But again, they would encourage in that age group doing more outdoor activities, again, limiting the size of the group that's together. But once you hit elementary school, the CDC does recommend everybody wears a mask. And I will tell you that one of the things you can do at home is if your child is resistant to wear a mask, you can practice at home for a short time and let them get used to it. And if they get used to it after a while, they'll feel comfortable. I'm always entertained or interested in, I see some very young children come into my office and the child is wearing the mask, and actually some of them feel funny taking it off, and as an ear, nose, and throat doctor, I need them to take it off so I can examine them and look in their mouth, and they've gotten so used to wearing it that they feel okay with it on. And so again, I would practice those techniques.
Awesome. Well, thank you so much, Dr. Josephson. I think to recap, you touched upon this many times throughout this evening's presentation, to keep the lines of communication open between the family, the parent, and the teacher and the schools, to keep the lines of communication open between the parent and the pediatricians or their doctors. And if the parents have any feelings and need additional guidance, to reach out to their pediatrician and talk to their doctor about their specific child. No two children are alike, right?
You bring up a great point. No two people are exactly alike. And there are some children that need different types of environment for learning, different types of things because they have special needs. And, there's so many things that we need to take care of, and that's why we're called individuals.
Yes.
But I will tell you, we do work better as a team or as a community. And so in order for us to beat this, we have to respect each other. We have to work together. We will beat this virus. We've beat a lot of things before. But again, we're each individuals. We each have our own individual things that we need and that we want. And so we need to make sure that we respect that and take all those things into consideration. Absolutely.
Excellent. Well, again, thank you. Thank you, everybody, for joining us tonight. We really appreciate the opportunity to share our expertise and our guidance with the medical direction Dr. Josephson shared with us tonight. So thank you. If you have any questions, we encourage you to send them in, and know that we are here for you and we are here for your children.